My periods generally lasted anywhere from maybe 7 to 8 days on a good month, what I would call a good month, and they were heavy from the start to the finish. And then I also had frequent times where my periods would last anywhere from 10 to 12, maybe 14 days. So I felt like I was bleeding for 2 weeks. I would always have tampons, and I'm not talking the regulars. I had to carry the super tampons, which I didn't like to wear because I just, that can get you into trouble too, but I had to because I would bleed through everything, and even the super ones, I would be changing 20 to 30 minutes in the first couple days of my menstrual cycle, and it was constant. So not only would I be wearing a tampon, I would also have to wear a pad. So I had both going on, and just to protect myself, and I would have to change both of them quite frequently. So I was always carrying that stuff with me. But it definitely affected my family because, I wouldn't want to go places because I was embarrassed that I was going to have to leave and change clothes or these kinds of things. And along with that, there was a whole gamut of emotions. I could go anywhere from crying about the silliest things to immediately being angry and wanting to scream. And so that had a direct impact on my family. Yeah, we did do research about different treatment options, and I tried some. I tried the birth control and the pills, and then the research on the IUD. Hearing these stories of these women that tried the Minerva procedure and was so happy and had such relief, and these were women that were having the same symptoms as I was having. And so I thought, well, if they can have this relief after the stories I've heard they're having, I want in on that, and I want that freedom for myself and for my families.
Ablative technologies now that can be performed in the office with the push of a button with a far greater success rate and safety rate than ever in the past. And the Minerva embodies every one of those improvements.
Now to open the cervix a little bit more, and right at 3.5 centimeters, so that fits exactly with a 4 centimeter cavity. Once you add 7.5 centimeters minus 3.5, so we're at exactly 4. So we'll take our device now, and we have our machine turned on, and we're going to take this piece of plastic and put it aside. We're going to take our syringe, which we use to fill our cuff balloon, so that'll work perfectly. And once we have the device with the filters in, we're going to test the machine. And
one of my favorite features on the Minerva is the automatic safety check it does before I start the procedure. When you begin a procedure and you attach the device, it automatically cycles through safety protocols, and you can see on the screen that your device is passing, which leaves you very comfortable and confident to say, this is going to be done right.
It's testing the device right now, and we are getting to be green and good to go. All right, we have a good device. So I'm going to hit the balloon or the green button, which decompresses the device. I'm going to place it into the cavity, and I'm going to widen it and snug it forward just a touch.
The single biggest difference from the patient's perspective between Minerva and the older ablative technologies is discomfort with the actual procedure itself. The procedure is extremely well tolerated in the office, in the outpatient setting, where I used to have to talk patients through an ablation. Now I simply talk to my patients while they're having an ablation. It's a huge difference.
I'm going to take off my Alice clamp, and we are ready to go. So I hit the start button, and the machine is going to have 120 seconds on the screen. That's going to let you know exactly how long this is going to take.
Okay?
Okay?
Yep.
You ready to go?
Uh-huh.
All right, here we go. It's doing its last little series of checks. You passed. Here we go.
Yay.
Now you'll feel a little cramping. Again, that's muscle cramping. It's hard to stop the uterus from doing that.
Yeah.
But once it starts counting down, we're going.
As a physician, when I advocate a procedure, I always have to talk to the patient ahead of time about what to expect. When I would explain an ablation in the past, I would have to talk to the patient about pain relief as well as cramping, because the uterus cramps no matter what you do. You can't get relief from muscular cramping without general anesthesia. And the older ablative technologies, the patient would experience significant discomfort and cramping. With the Minerva, I warned my patients, and afterwards I often found that I oversold and underdelivered when it came to pain, which leaves the patient quite happy and me pleasantly surprised. One of the big advantages of the Minerva system, color touchscreen, which outlines every step of the procedure. An understanding of how it works behind the screen is useful, but the actual technique to perform the procedure is very, very simple, and that inevitably reduces the chances of error and complication.
So you're 2/3 done. We've got 40 seconds to go. And you're doing really, really well. Well, I shouldn't tell you that. How are you doing?
I'm doing okay.
Doing okay?
Mm-hmm.
All right.
No worse than a menstrual cramp.
And you've had your share of those.
Yep.
So you know what to compare it to.
Yep.
Okay. The last 10 seconds, we're just going to count down so you know what to expect. And here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And that's it.
Clinical perspective, one of the big differences between the Minerva and older ablative technologies is the recovery. The recovery involves less discharge, less discomfort, no time off of work, and then long-term, the success rates with Minerva as opposed to older ablative technologies is night and day. So Andrea, we're done. You just had an ablation. How would you say you feel?
I feel great.
Okay, how would you describe the procedure itself?
I was fine. I mean, I was relaxed. I was comfortable.
What would you compare the discomfort to?
You know, in the beginning, having the cervical block, that stung a little bit, but it was quick and it didn't last. And, you know, once the procedure started, I had a little bit of cramping. I'd probably rate it maybe a 4.
How would that compare to one of your periods?
You know, it was like in the same areas, but it wasn't as intense. Like a menstrual cramp for me would like bend me over and would go down my legs. I didn't have that.
Well, that's kind of nice.
So it was just localized.
So would you recommend this procedure to a friend?
Absolutely.
Okay.
In fact, I have them lining up already.
All right. So in terms of what you expected today, was this about what you expected?
It actually was a lot easier than what I expected.
I'm glad to hear it.
I was nice and calm, and yeah, I was impressed. So I thank you, because you made me feel comfortable too. So
well, you're very welcome. I've tried all of the ablation technologies. I started out with rollerball when I was in residency. I moved to doing balloon ablations when they first came out. I've tried cryoablations. I've tried hysteroscopic hot water ablations, and the problem with all of those procedures were technically they were either challenging or had complication potentials that I wasn't comfortable with, or the patient's discomfort during the procedure was enough that I couldn't advocate doing it in the office. Now with the Minerva, I can do the procedure in the office in a very comfortable setting with appropriate medication with a degree of safety that I'm very confident in.